Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to again round up the key COVID-19 pandemic issues this week as they relate to dentistry. This week, the Scottish Government outlined a four-phased route map through and out of the COVID-19 crisis. Tom Ferris, the Chief Dental Officer for Scotland, outlined a phased return to the reopening of NHS dental services in Scotland, and that includes three phases. Phase 1, that involves the increased capacity of the urgent care system. Phase 2 sees NHS patients starting to be seen in NHS practices, and Phase 3 involves a limited introduction of aerosol generating procedures to dental practices depending on risk and mitigation. And we'll be working with Scottish Government. We'll update you once more information becomes available. Meanwhile, in Wales, just today, Vaughan Gethin, the Welsh Minister, introduced the Welsh Government's roadmap for dentistry. And this describes the rationale for moving out of lockdown and from the current red alert phase, also into a phased return to general dentistry. And the BDA in Wales has been contributing their views to inform the CDO's planning, and it's been a highly fruitful collaboration so far. Colette Bridgman's vision is to use the learning from the contract reform process across the last 3 years, using a risk assessment and prevention pathway to shift away from an activity-based contract. And the BDA in Wales will continue to work with the CDO to develop detail, and we'll also keep you informed on that development. Meanwhile, in England, work also continues on expanding face-to-face care. Progress towards expanding provision is being related to a number of conditions being met, and these conditions will be focused on wider public health factors. For example, when the R number is low and when the prevalence of the virus within the population is reduced, as well as the wider healthcare system's capacity to support patient care. The expert advice around these factors driving the decision about when to move ahead comes from the Independent SAGE Scientific Advisory Group. As part of the ongoing discussions, the BDA has emphasised consistently the need for expansion of care to take place as quickly as feasibly possible, given the growing number of patients in significant need of care and the desire for practices to treat their patients, whether in the NHS or in the private sector. Any timescales will be dependent on those conditions being met, but we're hoping to get a clearer indication next week on timings, and we know and share your frustrations on this issue. With the easing of social restrictions, we know that many practices want to begin face-to-face care. Private practices in particular are in an unenviable position, wanting to treat their patients and generate income, whilst at the same time needing to balance those public health considerations. In England, the CQC confirmed its position this week that it cannot require providers of dental services to close unless it finds clear evidence of a breach of regulations. As for the BDA's view on this, we've advised members that risk assessment has to be done by the practice and team, and that you should only provide treatment where it's safe to do so. We've issued clear guidance on this, and members can follow a link to that below the video. One of the hurdles for private practices opening up to providing more care relates to indemnity cover. We've issued a statement today to our own indemnity members to reassure them that, whilst a defence will always be determined by the facts of particular circumstances, they can be assured of cover from BDA indemnity. As we cannot exercise our discretion in coverage, members can confidently look to us to be by their side through these challenging times. General Dental Council announced this week that it will not make changes to the annual retention fee or to introduce an emergency payment system. We'd previously written to the Council asking them to take action to support registrants during these uncertain times, and we wrote yesterday to the Chair, Bill Moyes, heavily criticising the decision, which has caused enormous resentment in the profession. The profession obviously faces grave financial uncertainty, and the failure by the regulator to show flexibility is extremely disappointing. We've called for much needed transparency in the process of setting the ARF, and we'll keep you posted on any developments. We were pleased to see members of the House of Lords standing up for dentistry this week and really highlighting to government the crisis affecting the sector. Lord Hunt called on ministers to set up, and I quote, a programme of work with the BDA and the CDO to establish a national plan, get dentistry back on track and save the profession from ruin. Lord Rogan commented on the sterling effort of dentists in Northern Ireland, but also warned that some practices could collapse without further support. In total, 11 peers took part. We're grateful to them for continuing to keep the pressure up on government. Meanwhile, our chair Mick Armstrong has written a blog that sets out in no uncertain terms the seismic impact of COVID-19 on UK dentistry, and that's based on the evidence that we put forward to the Health and Social Care Committee, which is holding an inquiry into the future of healthcare post-COVID-19. In his blog, Mick outlines the 5 core issues that we put forward in our case to the committee, so do have a read of that. And that's all from me today. Have a safe and healthy bank holiday weekend, and I'll be back next week for more updates.